Think about this for a second. Right now, over 2 billion people can't see the world clearly. It's this massive global crisis that's kind of hiding in plain sight. So today, we're going to dive into how artificial intelligence is becoming this incredible new tool in the fight to bring sight back to millions.
All right, here's what we've got on tap. First, we're going to get a handle on just how big this vision crisis really is. Then, we'll look at why we're falling behind. After that, we'll get to the exciting part, the AI revolution in sight and how technology and policy can work together. Of course, we'll touch on the challenges and then wrap up with a look at what the future of eye care might hold.
So, to really grasp what we're up against, let's start with a few numbers. And trust me, they are pretty startling. Okay, get this. The World Health Organization says there are 2.2 billion people worldwide living with vision impairment or blindness. Let that sink in. 2.2 billion. That's more than a quarter of everyone on the planet.
But here's the part that's truly mind-blowing. Out of all those cases, a full billion of them, that's nearly half, were either preventable or haven't been treated yet. So, you see, this isn't just a medical problem. It's a problem of access. And, this isn't just a health crisis. It has a huge economic fallout. We're talking about $411 billion in lost productivity every single year. And that's not just some abstract number, right? That's real people, stalled careers, families struggling, and a major drag on national economies. So that leads to the big question, doesn't it? If so much of this is preventable, why are we so far behind? Well, the answer really comes down to some deep, systemic barriers and, frankly, massive inequality in healthcare around the world.
And this just lays it all out. In low-income countries, you've got maybe 3 or 4 eye specialists per million people. But in high-income countries, it's more like 76. That's a 20 times difference. I mean, just imagine that gap in access to an expert who can save your sight.
This incredible gap creates what some researchers have called a desert of eye disease treatment. And that's such a perfect description, isn't it? These huge areas where millions of people just have no way to get the basic care they need.
So you see, it's not just one thing. It's really a perfect storm of problems. You've got specialists in the wrong places, not enough training for local healthcare workers, people who don't even know they're at risk, and old, slow screening methods. It all just piles up. Okay, but this is where things get really interesting. What if technology could help us leapfrog over some of these huge gaps? Well, that's exactly where AI comes into the picture, and it's starting to completely change the game. Let's take diabetic retinopathy, for example. It's a huge cause of blindness. Now, with AI, a health worker in a small village can use a portable camera, snap a picture of someone's retina, and boom! The AI analyzes it in seconds, gives a risk score, and flags anyone who needs to get to a specialist ASAP. All of a sudden, screening becomes fast, cheap, and possible pretty much anywhere.
And it's not just for that one disease either. This is just the start. We're seeing AI models pop up for all sorts of things, screening for glaucoma, checking on patients after cataract surgery, and even predicting if a kid's nearsightedness is going to get worse, all from a simple photo of the eye.
But okay, let's be real. Amazing tech isn't a magic wand. For AI to actually work in the real world, it needs to be part of a healthcare system that can support it. And that means the rules and policies have to catch up to the technology. The WHO is really pushing for this idea called integrated, people-centered eye care. It's a bit of a mouthful, but the goal is actually super simple, even if it's ambitious. Make eye care a normal part of your regular checkup. Make it something everyone can get and everyone can afford. And we're already seeing countries put this kind of thing into action. China's National Eye Health Plan is a great example. They set these really clear goals, like let's do more cataract surgeries, let's get better at early diagnosis, and hey, let's use digital tools to do it. They focused on building out their eye care network all the way down to the village level. Now, rolling this out everywhere is definitely not as easy as just plugging it in. There are some really big hurdles, both technical and ethical, that we have to be super careful about. I mean, think about it. How do you make the new AI software work with the old hospital systems? How do you keep all that patient data safe? And here's a big one. How do you make sure an AI trained on data from, say, North America works just as well for people in Southeast Asia? What about bias? And what happens when it makes a mistake? Who's responsible? These are the tough questions we've got to figure out. Yeah, it all really comes down to this one crucial question. The AI learns from the data we give it. And our data reflects our world, biases and all. So the challenge is, can we build an AI that's better than us? One that doesn't just copy our biases, but actually helps us see past them.
But even with all those challenges, the future here looks, well, it looks a lot brighter. And it's not about machines taking over. It's about a new kind of partnership between doctors and AI.
And this is probably the most important thing to remember. The goal here isn't to replace clinicians. It's to give them a superpower. Think of AI as a tool that can handle the thousands of routine screenings, freeing up our amazing doctors and nurses to focus on the really tough cases where their expertise is needed most.
Ultimately, the dream here, and this is what the researchers are saying, is that this technology can finally level the playing field. It's about creating a future where top-notch eye care isn't just for people in rich countries, but is something that everyone, no matter where they are, can have.
So that leaves us with one last question to chew on. We've been fighting blindness for centuries. Is it possible that this new team-up, this partnership between human skill and artificial intelligence, could this finally be the breakthrough that brings clear sight to everyone?